more and more doctors agree that there are 5 common factors that can lead to heart disease and diabetes, and that anyone with at least 3 of these characteristics is at especially high risk. Collectively, these factors are known as metabolic syndrome.
The metabolic syndrome is definitely not a disease. It's a collection of 5 well-known cardiovascular risk factors, of which if you have 3 or more of them, you have the metabolic syndrome. The 5 risk factors for the metabolic syndrome include a blood pressure of 135 systolic or 85 diastolic, which are not very high blood pressures. Hypertension is actually defined as a blood pressure of 140/90. So this is actually before the threshold of hypertension. An increase in the abdominal fat as measured by a waist dimension with a tape measure of 40 inches in a man and 35 inches in a woman. A fasting blood sugar of greater than 100. A HDL cholesterol of 40 or less in a man and 50 or less in a woman. And the 5th risk factor is an elevation of one of the fats in the blood called the triglyceride. A value of above 150 is considered one of the components of the metabolic syndrome. It's most important for us to all realize that none of these values is considered a major risk factor in itself. They're all actually normal values, but when put together, 3 or more of them constitute a very high risk. While they're all very, very common individually, about 20 to 25% of adults in the United States have the metabolic syndrome defined as 3 or more of those risk factors. So almost 1 in 4. Patients with a metabolic syndrome have a 2 to 4-fold increased risk of developing heart attacks and strokes, and about a 5-fold risk or a 500% increase in the development of diabetes. The individual risk factors need to be treated no matter what, but if you look at them collectively, they respond very, very well to lifestyle change. Very often, it's a lifestyle of physical inactivity, a lifestyle of eating the wrong foods and too much of them that contribute to this. And there's also genetic factors. So the important thing is if you change your lifestyle, you can make a big impact on the metabolic syndrome risk factors and markedly reduce the risk of diabetes and heart disease.